The acupuncture, what the Chinese herbs can do is they can heal a lot of the damage that occurs as a result of the autoimmune disease. They can really heal that inflammation. They can heal the tissue damage that occurs due to autoimmune disease, and they can also sort of calm down the mechanism in the body that is saying, I have to attack myself.
All right, great. So we are here back with our collaborating with healthcare professional series. And I'm super excited because today I have my good friend Tracy Soltesz on the call, on the video with me. And we are going to be talking about one of her specialties and an area that I have kind of a subspecialty in, which is working on autoimmune conditions with Chinese medicine, with acupuncture, with herbal medicine. And it's an area that a lot of people don't know is something that is out there and is really very well treated through the Chinese medicine lens. And so Tracy is the founder and the primary, or one of the acupuncturists over at Kunlun Mountain Acupuncture in Annapolis. And welcome, Tracy. Thanks for being here.
Hi, Ryan. Thanks for having me.
Yeah. So tell me a little bit about just start with a little bit about how you got into autoimmune conditions, and then we'll talk a little bit about how acupuncture works for them.
Sure, yeah. So, I mean, my story with autoimmune conditions really starts with my own story of coming to acupuncture as a profession. I myself, from a young age had some significant autoimmune illness. I got, a lot of different labels placed on it throughout time, but none of the doctors could really figure out truly what was going on, what was the root of it. And I just, tried so many different things. I tried a lot of different medications, especially when I was younger, a developing female. A lot of those like heavy pharmaceuticals really made me even more ill. And I actually spent a lot of time during my high school and college years just not being able to even get out of bed. And so when I was introduced to acupuncture, it was actually through my pediatric allergist. And this was a doctor who was a pediatrician for so long and was seeing how so many environmental factors were affecting his pediatric patients and causing some of these significant things like I'm describing. And so he specialized in allergies because a lot of times people who have those autoimmune issues, an allergic reaction to the foods we eat and to substances, more than just like pollen and dog hair, really is showing that there's sort of this, inflammatory process in the autoimmune system. Like everything that's coming in, it's seeing as a foreign invader and attacking it. And so, after years of working with him, I got really healthy, I got really well, and he kept recommending that I go see an acupuncturist. And I kept thinking, how can a bunch of needles help that? Like, whatever. And so when I was, my undergraduate degree was in something completely different. It was in political science. I was working at a tabling event for a nonprofit. And when my shift was over, I started walking around to see the other tables. And I met this fantastic acupuncturist who was like so wonderfully delightful and bubbly. She would just not take no for an answer. And so I thought to myself, okay, I'll go get treatment. Then I can tell my doctor that I tried it and get him off my back. And of course, I was thinking I would go back and be like, look, I tried acupuncture, like it didn't do anything, but I did what you said. And of course, it was so fantastic. I walked in saying like, I'm here to work on this condition. And she said, yeah, but we're going to work on all these other things too, because they're all related. And just everything improved so much that I became curious and I wanted to know how it all worked. And so I changed my whole career and I went back to acupuncture school. And then as I moved on and as I graduated, I knew that, this autoimmune focus was something that I really wanted to be able to share my success with other people.
That's amazing. It's amazing. You know, it's an obvious transition. You know, from government and politics into acupuncture,
Of
um,
course, right?
and but more importantly, it's interesting to kind of hear it through your voice as somebody that has experienced it, not just treated it. You know, and that's something that gives you a different level of depth and understanding for the patients that are going through this, and for those people that are watching that don't really know what an autoimmune condition is. It's essentially any condition that the body's own immune system is attacking its own tissues. So things like type 1 diabetes, rheumatoid arthritis, irritable bowel syndrome. It's not just the immune system that's related. It could be the digestive system, but it's a sign that the body is attacking itself for some reason. It's some inflammatory response that the body is not recognizing many things as a problem that for most people aren't a problem. And it's a really important thing to recalibrate as if you're the one going through it, obviously. And so the practitioner, there aren't great solutions on the allopathic side for autoimmune conditions. And so why is it that Chinese medicine has been successful? What have you found, and why do you find that your patients are responding to the type of treatment that you give? If there anything specific that you can point to?
Well, I think you hit the nail on the head with allopathic treatment. Even with the advances we have in technology now, where we can, run blood tests, we can run these things. Those all used to not even exist, and you would go to the doctor and you would tell them that you had these symptoms, and they would basically blow you off or think it was all in your head, or think that you just needed to like get up and go. And now that we even have these diagnostic systems, they show us what might be going on in the body, but I feel like they don't really understand what to do about it. So they instead, like the primary treatment, even when they can diagnose one of these conditions, is to give something that just suppresses the immune system. And we have a lot of these pharmaceuticals out there that, when they're necessary to suppress the immune system, they can be life-saving, but they have a cost, as well too. They're suppressing the immune system to everything out there. And so my patients that are taking these really heavy duty medications, they're very vulnerable to other types of illnesses. Some of these pharmaceuticals have been, shown to cause other conditions. And I think what I have found with Chinese medicine is that a lot of the things that we can do, whereas they're probably not going to completely cure or reverse anything that's going on, a lot of these autoimmune systems processes are something that are sort of like deeply embedded in us, and something that we're doing in life is sort of activating that genetic code and making it worse. But what the acupuncture with the Chinese herbs can do is they can heal a lot of the damage that occurs as a result of the autoimmune disease. They can really heal that inflammation. They can heal the tissue damage that occurs due to autoimmune disease, and they can also sort of calm down the mechanism in the body that is saying, I have to attack myself. And that can, like I said, where it can't reverse, the illness itself, it can significantly reduce the symptomatology over time. And the other thing too is that these patients, they start to recognize what different things they do in their life that make the condition feel worse. When they're taking one of these pharmaceuticals that just suppresses all the symptoms down, we've shut off the body's messengers. But with acupuncture and Chinese herbs, we're learning how to listen to the body's messenger. And so then if I start to feel the hint of something coming on, whereas, before this, it would just be like full blown and I wouldn't be able to get out of bed and I would feel awful. But now I start to feel that tiny movement in me that says, oh, I need to stop what I'm doing and pay attention
Mm.
and shift what I'm doing. Maybe I need to stop eating this food that's triggering it, or I need to, do something else. And that can really help patients feel empowered over their own body systems and their own health.
Yeah, that's great. I mean, you just hit on a bunch of really important points, I think, as it relates to this. For sure, there's an awareness piece that comes into the picture. When you're taking a pharmaceutical drug, you're essentially hoping that that drug, whatever it's doing, is just taking care of it, and you go about your business. And so, one of the things that we focus on as holistic practitioners is really helping you to see some of the little signs and symptoms that you were describing, and so that's an important distinction. The other thing that I think you pointed to is something that within the industry of Chinese medicine and holistic medicine gets kind of over talked about, but in general, I think it's a really important concept, which is this idea of what we call the root and the branch, right? The symptom, dealing with the symptom, but also addressing the underlying problem. And how do you do both at the same time is a real strength of Chinese medicine and many holistic practices. So when you're dealing with the tissue repair that you were describing, and you're simultaneously trying to downregulate the way that the immune system is attacking itself without suppressing the immune system. But when we call it downregulating, because it's like suppression with a pharmaceutical drug is like, here's your immune system under normal circumstances, and here it is now. And if you're doing a down regulation, you're just going like, okay, it's here, it's going crazy, and now we just want to bring it down to there and just settle it a little bit. And so these smaller kind of calibrations where you're just turning the volume up or down a little bit based on the experience that the patient is going through are really well balanced with slight changes in herbs, slight changes in acupuncture point selection, how much we're stimulating a point or how much we're releasing a point, and all of these things can have a role in recalibrating or rebalancing the system, as opposed to just suppressing it the way that you were describing before. So that's really, really important stuff.
Yeah, I find too that when you start to specialize in autoimmune treatment, we really focus on learning what type of points, what type of herbs are adaptogenic, and by that I mean, like you said, we're not suppressing it. We want to bring it back into balance, and we want to optimize the body's ability to function on all of these different internal systems, most particularly the endocrine system, which really plays a huge role into autoimmune disease. And so we wind up choosing points, we wind up choosing herbs that have the ability to re-regulate that functioning so that it's optimized. So, there's some points that are directional, there are some herbs that are directional, but we're using ones that, whether somebody has high blood pressure or low blood pressure, it doesn't matter. This point just helps to bring it back into the proper balance, the proper range there.
Yeah, fantastic. Well, I could probably, talk to you about this for hours and hours, as I know we have in the past, and I know we will in the future. But for the purpose of this, I just wanted to give everyone a taste of, how much depth you can get into as you relates to something like an autoimmune condition in a short period of time, and just let people know out there who are struggling with autoimmune conditions that there are those of us out there that are here to help, that we want to be in your corner and be part of your healthcare team. And there's so many benefits that you can get from looking into Chinese medicine, other types of holistic medicine. And you have two people here on the call right now that are extremely able and willing to help and love to. So thank you for joining us. And Tracy, thank you so much for being here.
Thanks, Ryan.
All right, everybody, take care.